helpful. Thanks. So with that, I think I'm very pleased that I can hand over and ask Nonso to tell a little bit more about the solution to connect waste collection with access to health and health insurance. So Nonso, please take it away and help us understand what you're doing in Nigeria.
Thank you, Ellie. Hi, everyone. It's great to connect with you. My name is Nonso Oprom, and I'm connecting from Nigeria, actually the southern part of Nigeria. So the idea of SosoCare started because we wanted to change how people see medical insurance. Practically, myself, I have worked in the insurance space trying to sell insurance a couple of years ago. You know, as a sales insurance agent, I struggled to sell the product because of a couple of reasons. You know, it was a rainy day and the weather was quite hot. And, you know, when you live in communities where people work really hard, where poverty is, you know, widespread, and people work to eat and not to build mansions or use expensive cars, medical insurance is listed in their priority. So having worked as an insurance agent every single day, I try to sell insurance product, and most times when I meet people, I get more rejections than the product I sell. And one of the things I realized then was people practically didn't, even though they know that they needed insurance, but they know that it wasn't a top priority for them because obviously they were looking for money to pay for their children's school fees, pay for rent, and get clothing and basic things. So insurance was more like a luxury. Outside that, you know, there was also this very big problem with insurance in Nigeria. We have this third-party motor insurance, whereby there's a compulsory insurance that every car owner must have an insurance. And, you know, people buy it not because they want to make a claim, because they have to buy it because it's a mandatory law. So most times they don't even know how the claim process works. So it created more room for fraud for people than actually the whole idea about insurance. So it made it more difficult for me to sell insurance. And one day, as a sales insurance person, I was trying to speak to a woman who was, you know, having a small business when she was exchanging recyclable plastics, you know, with a local herb store. And curiously, I tried to understand what they were trying to achieve, you know, with the plastics. And they told me that, you know, by exchanging recyclables, they could be able to, you know, get some herbs to treat malaria and, you know, make sure that the children were healthy. So it struck me that, you know, I was trying to sell, here is me trying to sell a product to people, you know, to make sure they get access to quality healthcare. On the other hand, they were already looking for alternative ways to finance their medical need without having to spend a lot of money, more like trade by barter. So it intrigued me that, you know, I randomly asked them, what if I am able to give you, you know, medical insurance in exchange for plastics? You know, it was just, I just wanted to see what they would say. And somehow, you know, we struck a deal. I did it for 6 weeks. And within that 6 weeks, I had over 90 women, particularly women, gave me recyclables, mostly to provide insurance for their children and not for themselves. So that within that plastic that I could ever think, you know, I didn't have a lot of space to keep those plastics. So it struck me that, you know, there could be alternative ways to be able to help people, you know, finance their medical care without having to pay for it. So we moved that from something that we wanted to test run as a pilot to convert it into a full business. We couldn't have done that without the support of World Bank then. You know, we had World Bank help us to understand that we are not only solving healthcare problem, we're also solving climate problem. You know, it's more like a climate health problem. So we were on the one hand, we are trying to use one stone to kill two birds. So it was exciting for us to continue the journey, you know, being able to move away from a traditional way of collecting the recyclables ourselves, door-to-door process, which was not scalable, to bringing in technology. We have to bring in offline USSD technology that doesn't require internet. And for us to do that, we also understood that insurance require agents who distribute those products in communities. So we had to build food agents. We brought in people who never owned insurance in their lives, people who never used insurance in their life, people who have the least level of education to become an insurance agent. Because these people are the most difficult people to build trust. And so bringing them on board, knowing that their income status were not much, we had to build income opportunity for them, made them agents that help us to sell insurance in their community by accepting recyclable in their host community. That way, we've been able to provide insurance to thousands of people across communities and importantly, build trust, as well as support people with education around insurance product. So we are currently scaling Nigeria. And one of the things we are doing is to, scale our API to be able to reach other countries where there is urgent need for healthcare access as well as environmental intervention. Thank you very much.
Thanks, Onso. It's interesting. Can you tell a little bit about how that process works? Like, let's take the plastic bottle as the object. So it's
Yeah.
somewhere on the street, and then who's picking it, who's recycling it, who's bringing it to you, who's offering the insurance? Just the practical side of how
Okay,
social care
the, the
works.
model is the model is quite simple. We one of the biggest challenge we had was how to make insurance simple for an ordinary person. We know that it's easy. People don't wake up online. People don't wake up in this part of my world and go to the internet to buy insurance. Nobody wakes up in the morning and go online and say, I want to buy insurance. It's rare. That's why you have a continent of 1.3 billion people and less than 5% of our population still have insurance. So it means that for every 100 people you see, maybe only one person have a medical insurance or two. So we have figured that for us to be able to distribute insurance to low-income people who are not tech-savvy, who have limited education, informal workers, we need to make the product very simple. The choice of words, the technology, as well as the process of collecting recyclables. Because one big problem with recyclables is that you must ensure that the supply chain is right, and you must ensure that you don't have to put a lot of money in collection process, as it will eat up on your unit economics. So one thing we did was we first built the US mobile app, and we realized that low-income people don't have internet, and they don't have money to buy internet. So because we are trying to serve two audience, we have mobile technology whereby you can go online. You can download SosoCare on Google Play Store or iOS now, then go online, then buy a policy. It could be a travel policy, it could be a medical insurance policy, it could just be a random pharmacy, it could be like mosquito insurance. Then anytime you're sick, you can call in, the doctor will speak to you, then refer you to the nearest pharmacy to get treatment or hospital. Now, for low-income people who don't have money and who don't want to spend their money on insurance because they've not used it before, what we design is a simple USSD where they can dial the code. When you dial the code takes you to a simple menu. Then with the menu, you can, because there's a way we connected the menu so that way we can make it quite easy for people. So with the menu, all we need to provide insurance for you is your telephone number. The telephone number, we can be able to get good data. That way, it's easy for us to collect your simple information, then be able to provide you insurance. And for us to do that for low-income people, exchanging recyclables, we work with our agents because they are the ones, distributing the insurance on our behalf. So our technology enables them to sell insurance any time of the day they want. At the end of the day, we can always reconcile with them. So it's quite simple for people paying with money as well as people not paying with money. We have to channels of distribution of the product. I
So
don't
the
know if
last
that answered your question.
Sorry, Nonso.
Can you
Can
hear
you?
me?
Yeah, so the last part we had some hiccups. So maybe you can just the last minute, could
Oh,
you repeat that
oh,
one?
sorry. So what I said is, so we have two channels of distribution for the product. We have the online, download it now, buy a policy. Then we also have the offline distribution, bringing people who are disconnected or they don't have internet. So that way it helps us to bring inclusion. And actually, that's one of the fastest way we've been able to bring in thousands of people in the informal sector. And the good thing for us is that about 95%, so we did a survey with UK Aid. And one interesting thing, and the FSD Africa, one interesting thing we noticed is that 90% of they don't know, most of them don't know what is insurance. Most of them are buying insurance for the first time in their lives. So, which is quite interesting for us because we are bringing in a different type of customer.
So we are having a little bit of hiccups, but we are getting the general gist of your conversation. I was actually super keen to hear more about your offline channel being the
Oh,
biggest and the easiest way to find to reach many low-income women.
okay.
Uh, can you tell a little bit more about that offline channel?
Yes, of course. So our offline channel is our USSD. Can you hear me, or is my internet bad? Great. So our offline channels is our USSD. So that way it means you don't want to provide insurance for people. Our primary goal is to provide insurance for millions of people in the informal sector, irrespective of their income status. And most of these people only have feature phone, which means they don't have smartphones. So if we have to provide insurance for them using internet, that means a lot of people will be disconnected in our primary and our long-term goal. So we had to, design the USSD channel, which is more like you can pick your phone, dial *55* then it gives you a menu. That menu is like, it allows them to exchange, you could use the menu to find the nearest agent close to you, then go to the agent collects a few kilograms of waste from you, 2, 3 kilograms of waste. Uh, then in exchange, they can pay you money and as well give you insurance. So when we started with insurance alone, we noticed that low-income people didn't just want insurance because they also want money for food. So we had to, improve our model by changing it from complete insurance to embedded insurance. Embedded insurance means we can, instead of just giving them insurance, we pay them money and we also provide insurance to them. So which is more benefits to them. And we've been doing this with over 150 hotels, using that model to provide insurance, using waste generated by hotels to provide medical insurance for their staffs across some of these organizations. We do it with hospitality industry, not just cities, as well as very low income people across communities. Can you hear me?
Yes. So, do I understand it correctly that most of your work currently is in urban, semi-urban areas? And yeah, that's a good.
Oh, well, yeah. So the what we realize is that, more of plastic pollution come from urban regions. Low income people don't really have a lot of budget and disposable income to buy Coca-Cola or water parks. And so for example, Nigeria has over 30 billion plastics, and less than 5% of this is collected. Most of them are in urban cities. And there are no strong incentives to encourage middle class to recycle. Middle class are working. They don't want to recycle for small piece of naira notes. So for them, it comes with there's a stigma around that. So they don't want to recycle. But if there is a strong will for them to recycle, most of our customers are middle class who are recycling, not for themselves, but for people in their host community. It could be supporting children to get insurance. It could be a challenge for them. We also work with organizations whereby we work with them to recycle insurance, plastic for insurance for a community. So that way we tend to bring in more people into the pool of insurance as well as create knowledge around insurance product. But in the long run, one of the things we are looking at is to be able to also bring thousands of people in remote communities and in rural areas by looking at how best to, use post-harvest agricultural waste to provide insurance for people.
And I think that will be a super nice moment for us to bring in Tony into the conversation. I think, Tony, you have some experience in linking and recycling business in rural areas, in Nigeria even. So can I invite you to uh, ask some questions or share some learning experiences?
Yeah, thank you so much, Helen. Thank you so much, Nonso. We've had this encounter before, and we've had this conversation around how to localize this wonderful project or program, how do we localize it for communities? And we're still in that conversation on, okay, so communities produce a whole lot of local waste, agri waste and all of that. So how do we quantify this agri waste? And then in quantifying the agri waste, how can it then become a solution? But while this conversation is still going on, Nonso, I still have an interest in understanding why you decided to work with waste, and why did you think waste was a tool that could be valuable for this kind of structure you're building?
Thank you, Tony. So I think I didn't pick waste, actually. I was actually looking for a means to finance insurance. I was looking for every possible means to help me sell my product. So waste was the listing on my my target. I was just looking for, what can I do? What is the best channel for me to be able to distribute insurance policies? I started my career in telemedicine, trying to help people sell, download telemedicine to speak to doctors in remote communities. But people don't want to do that because they don't have internet. And people can just go online to browse medical need and check on Google and say, okay, I have headache, what's wrong with me? So it wasn't a strong business model for us. And we wanted something that we can do and it can generate revenue instantly. That was when we started looking at alternative ways to help people, and also help us be in business sustainably. That was how West came to us, because people, like I said, don't trust insurance. So we had to look for, what can we offer people trust about this product. And it's what normally to money to you in return for a strong value. You may why we pick recyclables instead of maybe foodstuffs or any other product.
Okay, so I mean, if I get you well, because at some point the network was going off, but if I could get you well, you were using one as a tool to build trust, and then they get the reward as a result of the trust built, right?
Absolutely, yes.
Okay, so I'm still wondering, because as someone who works in a community, I'm still in a box on, is this really making insurance relatable to the people? Because for me, that is still an ask, and that's still a question I have. Because it's really about making it relatable. It's really about making them understand that there is a need for it. So do you think this system is working in regards to that?
Sorry, can you rephrase the question again, sir?
So based on the kind of system you're running, which is using waste as a tool, right? Do you think it is working in terms of making insurance relatable to the people? Because we have a big gap. Like you said, for instance, in Nigeria, a good number of people do not have insurance at all, health insurance.
Absolutely.
And people are not really talking about it. So do you think this system is making it more relatable for the people?
Okay, Tony, I think your question is a great question. For us at work, one of the things we want to do, we believe in, is how can we help every single Nigerian understand that whenever they have malaria, they can walk into a pharmacy and get treated of malaria. We don't see it as insurance. We try to call it health plan, and we want people to know that they can have a health plan, not insurance product. So health plan means you can be able to get treated for a particular ailment. And one of the things we've seen is that people graduate in this product. People want to buy the list of that. One thing we've seen is that people graduate from this product, and then sometime again, they want to test the product. If it's working, they now want more complex product. They tell you, okay, I don't want malaria cover. I want something that is more complex. They're now willing to pay for more because that trust established. So it's a long-term investment. And for us, for cities where we work, there's a lot of advocacy and awareness, which we put in resources on as well. But when it comes to the impact, and one thing like from the report that we did with UK-Aid and GSME, over 90% of the people who we currently sell insurance to are not really people who have ever used insurance before in their lives. They are people who are buying it for the first time. So it means there's an impact in that. And most of them, again, most 75% of them have never recycled before. They now learn to recycle from us. They've moved from recycling once in a while to recycling, some daily, some weekly, some monthly. So you see a strong element of trust and again, behavior change around these two components, which are very big and catastrophic problems. So you cannot talk about environmental pollution without public health concern, because when the environment is dirty, for example, people can have get access to maybe be exposed to malaria because of sanitation problem or public health concerns from cholera, mostly for children. So you see that the both problems, you can't tackle this without also looking at this. And for us, being able to provide this to people through different channels, being able to have agents who we use as user acquisition channels, paying them for helping us onboard more people. I think it has helped us to reach communities, so most of the things we have done has been organic. Through organic, we've been able to reach 3 communities. We are opening another city in another state with the Ministry of Health in that state on the World Cleanup Day, which is the 28th of September. So that way we continue to build organically. And the good thing for us is that the recycling gives us the cash run, it gives us the cash flow to continue to be in business while we organically grow our microinsurance distribution.
Well, thank you so much, Nonso, for that. And so now I'm wondering, how affordable is this?
It's completely affordable.
How much is it?
Sorry?
How much is it?
Well, luckily, I would prefer to use dollar. If we use dollar, that's about 50 cents, about that. Mm-hmm. So it's quite affordable because we designed it with some big global insurance companies to make it quite affordable for low-income people. And again, we also have to look at the unit economics of recycling and collecting recyclables to make it work. There's a product that we are currently launching. That product will only require 120 can Coca-Cola or can beer or whatever, and you can have access to 1 year medical insurance in any pharmacy in Nigeria. So we're trying to launch that product by the end of September, because for us, it's about being able to reach more people in great numbers, bring them in, then manage them on the importance of insurance and awareness. But when you talk about sustainability, it's 100% sustainable for us. So we prefer when users pay us with recyclables than when we have customers pay us with cash. Because with cash, that means the marginal profit is more. We have to pay our insurance underwriters. We have to ensure, make sure that the business is working, then keep a small margin. But with recyclables, you have like 3 channels of income. You also make your money from the insurance. You also make, again, markup from selling those recyclables. Again, you also have to go to Europe and sell the plastic credit. So it gives you different revenue channels to be in business.
I'm really interested in understanding how the back end works, if it's something you want to talk about, especially for those who want to replicate something like this. So how does it work?
Absolutely.
I bring the waste to SosoCare. SosoCare takes the waste. So what happens from there? And then how does it bring that marginal income back or the profit back to SosoCare?
Okay, so there are multiple channels to that, and that's where technology comes in. So for us to scale, we need to make sure we have to bring in technology. And what technology helped us do was that we wanted to be, even though we are sleeping, we could sell a medical insurance. Even though it's raining, we could sell a medical insurance. Even if it's on a weekend, we can sell a policy without knowing we've sold a policy. We just want to log in on the back end and see that maybe Maria in a very remote community have sold 5, 10 policies herself. Maybe John sitting in a particular pharmacy have sold 15 policies. So that's what technology did for us in terms of scale. So empowering people with 2 options of payment, either they are paying with recyclables or they are paying with cash. Now, coming with the recyclable side, which brings in the interest of very low income people who actually, that's mostly how low income people buy policies from us. So what we did is that we built agents in communities. By building agents, these are like people whose income level were low, and we had to bring them, train them on, let them understand the vision of SosoCare and why insurance, is absolutely important for women and children. So most times we go with women because we understand that they have influence in their community and they can easily bring in more women trying to, protect their children against vulnerabilities like malaria or other basic, preventable diseases. So we train them, we empower them, we give them access to our technology to help them sell the policy. We encourage them to use the policy for the first time, anytime, whether they have joint pain or they have arthritis, we ask them to use the policy. You can't sell what you've not used. So the moment they are able to pick a random pharmacy of their choice, and we try not to influence the pharmacy they will choose. We ask them, choose any policy pharmacy you want at your own will. So you will not feel like we've called them to tell them that you're coming. So just do your thing. Let us know your experience with that. So one of the things that does is that it gives them the confidence that the product is working and it's real. So if they're able to use that product, then they can now go back to their community to, have their own channel to make sure that people can be able to come to them and bring those recyclables. And in the early times of our journey, one thing again we learned then was that people don't want to walk long distance to recycle. I want to leave my house and walking 1 minute, 2 minutes, I can recycle, whether it's for cash or for insurance. If the distance is far, I don't want to do that. So confidence was actually one of the key things. So for us, one thing we did is that for every 5 minutes walk, we made sure there was an agent there. So because our primary goal is to bring in millions of people into the pool of insurance. So it means we have to set up agents every 5 minutes walk, every 5 pole, put an agent, every 5 pole, put an agent. That way people can easily recycle, either we get some money or as well get a medical insurance or get a combination of both. So we collect those recyclables. We have off-takers that take these products from us. Then we have markups designed for this agent as well. So most times these agents make good money from selling that product than selling other things as a source of income. We've had agents that move away from different forms of business to being full-time SosoCare agents. And the good thing about their income is that most of them want their income grow. It can start with $10, then from 10 you make 20, from 20 you make 60, from 60 you make 200. It jumps because the more your income grow, that means the more you have, people, your downlines, people who want to exchange insurance for cash or for recyclables on that.
Mm-hmm. So what I'm trying to understand is how it works at the back end, because I'm trying to make it local in terms of understanding what would be the need. For instance, if we want to bring this to a rural community, for instance, and we say, okay, let us gather the organic waste. The question would then be, what happens from there? Are we going to start looking for a market for the organic waste to be able to generate the income? Or would there be already stable markets that we can tap into? That how does it really work for indigenous people? That's like the back end I'm trying to understand from the model that you're already running.
So what happens is that we always give out an API access, and those API access is to make the entire process easy for the franchisee that we give. For sometimes we give out franchise to people like we've done in Ghana. And one of the things we do with those franchises that you don't want to make the level of mistakes that we made building our SosoCare and losing a lot of capital. So we make sure that the entire process is right for you. We make sure that the entire off-taker of the product is right for you. We make sure that so once we open those API can allow you to see a significant amount of hospitals, pharmacy in those communities, and help it's like a package, help you to understand how to train the agent, help you to instantly create thousands of wallets for your agents and how they can make money. And as well, ensure that within every week or every 2 weeks, the franchisee has money in his wallet to be able to run their operations. So that's why we design it in such a way. But with organic products, we've not looked at organic product. It's something we are keen to explore, understanding that we cannot work without looking at rural communities where more people die from simple medical conditions.
I really like.
And again,
oh, sorry. Go ahead, Nonso.
No, go ahead.
I really like the drive behind the discussion, because we're trying to see how can we bring your inspiring solution to other areas, right? And maybe I can invite Nitin also into the conversation, but then from the other angle, like, would this be possible in India, for example? So Nitin, would you like to also join the conversation, thinking about, can we replicate, can we reach more people with such a solution, and what would be challenges for you to overcome? So I will shut up. Over to you.
Yeah, it's like always pleasure hearing you, Anso. So, like you are, like normally a social entrepreneur targets one problem to solve, but you are trying to solve two problems at one go. That's something great that you're doing. So, there are like a lot of question which comes up, like First thing which the discussion which was going on with Tony was Nansa, are you there?
Yes, I'm here.
Yeah, okay. Yeah, so I thought. Okay, so one of the things is like because if people are collecting waste and giving it to you, from insurance company perspective,
Yeah.
like there is a policy and there is a fixed kind of annual fee which is there, like because we had dealt with health insurance in the past, and we were talking to insurance company to break it down into monthly installments so that like every month they pay and every month they cover.
Mhm.
They didn't agree. It was the annual premium thing that was there. So and this waste collection, I think you must be doing on a monthly or a weekly or some kind of a periodic basis. So how does this waste collection and the premium payment work? And then the collection also may not be fixed because some month or some week, like they may have more waste.
Yeah.
Sometimes the amount of waste may be lesser than the premium value. So how does that work out?
So I think your question is absolutely a great question. So when we started earlier, we faced that challenge. We were only offering an annual cover. Can you hear me?
Yes, yes.
So we are only offering annual insurance cover. So annual insurance cover meant that every person must bring in significant amount of waste one time. We don't accept much slowly. It was a big problem, and people were not buying the product because they felt they want to buy, but they look at the time it should take them to gather those recyclables. It discouraged them from start. You know, I have not used this thing before, and you're telling me it works, and you're giving me conditions that makes it quite difficult for me. And so we looked at what was happening in India, with how we looked at insurance in India then was more like then India launched insurance around only inpatient care, all right? Inpatient, yes. So it meant that people were now still, there's still a massive market for outpatient care around insurance. And so one thing we understood then was Nigeria, there are a lot of people that have strong medical problems. But what if we have a complex insurance product, then we design another simple insurance product, more like mosquito insurance, malaria insurance, where a significant amount of 50 million Nigerians actually have malaria every single year. So if we can design a product that's, serve the need of nearly a quarter of the population, that's a good product for us. So, and we need to make it simple for use. We also need to make it monthly in terms of premium, and we need to ensure that the entire process is right. So that's one of the reasons why we chose that product, because we understood that it was actually serving the purpose of what we wanted, and it required lesser amount of recyclables to be able to offset within a day, because 80% of what people generate in their homes can actually be recycled. So that means within 2-3 days, and we had to make sure that we design policies in mind that within a week, the policy could be paid off. We don't want people to take more time to gather those recyclables. So one thing we encourage is that you have a small bag that once it's up to a certain kg, 2 kg, which you can generate in 2 to 3 days, then you can easily give it to the nearest agent, who can then in return give you a medical insurance. Sometimes not insurance, because people want insurance and also money for food or bread and other stuff in communities like that. So agents take a small portion, which is about 20-30%, provide them insurance, then pay them cash back to use it to be able to buy whatever they want to buy in between those periods. So that's how we've been able to, provide simpler products as well as give incentives, which is cash for low-income people to be able to come for the product. Because sometimes most of them don't really come for insurance. They want to exchange those recyclables for cash. They need money. So somehow you also offer them the both. And when they are sick, you force them to use it, and it changes their mindset about insurance forever.
Okay, because that's the following follow-up question that I have, because again, working on health insurance in rural India. So what we have seen is the awareness level of health insurance is very low. Because people
Absolutely.
feel that like why take a health insurance when like we are fit. so healthy and fit, so we don't need insurance. So that's why like it's becomes very difficult. And second thing is like the entire ecosystem is also especially in rural India is not properly developed. Like the healthcare service provider is not like may not have the proper infrastructure to provide the service which the insurance company wants. And the insurance company also, they have certain parameters on like serving the policy. So in that, so the policy holder or the insurance holder doesn't get the benefit. So I think similar kind of problem you may be facing there. Like so, there are two questions. One is like, how do you motivate people to take health insurance? One. And second is like, do you play any role in the entire ecosystem?
I would say a little bit more. So what we do is that for us to do that, I think one thing I have been able to do internally is make my team understand the importance of customer service. So our understanding and our idea is that no customer must be left waiting for a long time to access care. So we must make sure we are always happy when people want to access care. We want to make sure that people are able to access care. So that's one thing we internally we understand. And sometimes I randomly call the claim line to see how fast they'll pick the phone. Because for me, claim is very important. Because if someone called to make a claim and is unable to make a claim, then that's a very big problem. So that means we are not supporting as fast as we can. And sometimes after they've made a claim, we also do follow-up call to call in and support you and tell you, okay, everything is fine. That's why you need insurance, and to renew it, always refer friends and this. So one of the things we try to build on the long run is to build behavior change, build trust in those communities. And one thing that has helped us grow, we've been growing organically without strong investment in marketing. And one thing that has helped us has been word of mouth. We are able to offer insurance to Nathan, and because he used it without paying money, he's able to bring an additional 50 people. 50 people will refer more people and more people and more people. So that's how, and we also work with government to be able to create programs when governments have programs. So we have an agency here, it's called Women Affairs. It's take care of the welfare of low-income women through the government. Sometimes they are looking for means to create income opportunities for women. Multiple times they've invited us to speak to women so that we can create jobs for them, as well as support them to provide insurance for their children. So we have that symbiotic relationship with government as well as the community. But the most important thing we want to do, and sometimes every year we try to do a survey to understand where we are, what we are not doing right, what can we improve. And we also want to understand the number of people who are using our policy, on our product, to understand how they are testing the product. And the great thing for us is that most times what we have is we see people who are first-time to insurance users. Most of our customers are buying insurance for the first time in their lives. So it's like something they're excited to do. And when they don't use the policy, we also try to encourage them, to teach them how insurance practically works. Not because you bought today, it has expired, that means your money has gone. So we try to let them know it's a pool. So there's strong level of education, investment, and awareness to let those people understand how the product works. So and the good thing is that because it's more like we are building it around community. So even if, for example, Nathan Tony, and because you didn't use the product, you're angry that this product doesn't work, Tony can easily convince you and let you know, oh, this is the process, this is how it works. So for us, about relying on the community to help us reach more people than just trying to invest in marketing. Because we can't go to radio and tell people buy medical insurance, or go to TV and tell people buy medical insurance. These people don't trust this product. They need that level of interpersonal relationship with them before we can get to that stage of investing, just to reinforce our awareness of the existing product.
Okay. And so just the last point on
Sure.
like if SosoCare has to be replicated in any other country, say India.
Yes.
So what are the prerequisites, like what are the indicators, or what are the things which needs to be done, or what are the data which is required to start, say, SosoCare in any other country?
Okay, so practically the only thing that is required is waste, and I think there's waste everywhere, and that's the first thing that is required. And we know that almost everybody generates waste. And the other key element is that, the regulatory part of it must be right. We must make sure that, the regulating bodies everything is in line for the franchise that we want to give. Because for us, we want to open API, allowing the customer to use USSD without having to, reinvent the wheel and build all of this technology from ground up. So it makes it easy. And once we have those paperwork and we confirm that those paperwork are right, for us, we already have access to a lot of insurance companies which are global that allow us to be able to be wherever we want to be. For example, that the person we are giving the franchise understand, have a level of interest around what he wants to do, get some of the documents right, which is the ability to, more like a broker license, which you would need, then I think we can open those channels and train the person on how to collect the recyclable as well as dispose the recyclable, the pay to the customers. Can you hear me, Nathan?
Yeah, but there was some part we couldn't hear, but broadly, so got it. Thank you.
Oh, I
So
think
maybe with one eye on the clock, I would also like the others in the call and invite them to jump in if you have questions. And of course, Tony, your time wasn't finished. You can continue asking your questions, of course, that too. I do want to bring one remark question from the audience. I'm not sure if Sid is still there. Sid, are you still there? Then you can ask your question. But he left a note or a question, have you thought about community or a collective insurance? And of course, the name Credit for Communities actually carries the strength of a community. So, and I know in your model, one agent works together with maybe 80 to 100 other community members, so they can be considered as a community. But is there something about a community or collective insurance in this model? So, for example, if a community collects that amount of waste, you will provide the health insurance to cover for that group of people. That was a question from Sid, and I also think that's a very nice way of thinking, and probably you have already thought about it or experienced something of it. So a
Thank you,
collective.
Adrian. I think I saw that question and I was looking at the question. I saw it, is there a collective insurance and the tonnage that is required for that collective insurance? I think I saw the question. I was looking at the question. So we don't have collective insurance, but what we have is similar to collective insurance, but not collective insurance. So because, collective insurance from the question is about community, but what we have is collective insurance. Like, for example, we have a partnership with Hotel Association. So that means waste generated by hotels they have access to get treatment, at the nearest pharmacy or hospital cash. So that is similar to collective, but it's not community because this like organizations that provide because hospitality industry generates a field and it's creating value for them because the employees can get access to quality healthcare. So we may, explore that side of the impact to see how we can be able to bring in communities. And I think it's interesting because bringing in communities is easier and faster and better because it builds like community trust instead of having to build single trust across those communities. But if you have the entire community at once, it's easy for us to say, okay, this community is already loyal to how insurance works and education around insurance. So I think it's something that we will definitely explore.
So generally, like insurance companies, they like to have community insurance because, like, when the entire community is covered, the risk gets reduced.
Absolutely, yes.
So I'm interested in Nonso, I'm interested in learning more about what the adoption level has been in Nigeria. and obviously speaking like as a Nigerian, because I know that there's a whole lot of queues at the public health facilities. You know the way it works, people sharing beds and all of that. And so if you have this, how come people do not? Like, I'm just trying to figure out, like, this is the solution. But then we have a whole lot of people who don't know about it. So what's the plan to get it to the people?
Thank you. That's a very good question. So 2 years ago, we hired someone as a head of sustainability in northern Nigeria. And the only reason why I had to ask her to join our team was during our interview, she said, "How are you doing this kind of thing? And I live 5 minutes away from your office and I don't know about it." That was a very interesting question. And for me, like, that's the kind of people we needed to work with us there, because that means this person understood the importance of, building community and the importance of awareness. And the truth is that we've been building organically. And so it means we want to be able to continue to grow organically before we start investing to marketing to create awareness on the product. Because acceptability of a product is very difficult where there's a trust.
Sorry, Nonso, I'm experiencing hiccups. Do the others in the call have it too? Yeah.
Problem. And you don't want to rush to go. I want to build that level of trust to constantly refer organic growth.
No, and we lost him. That's a pity, but well, he will probably come back. Nonso, we can see you, but cannot hear you, and it seems that you're muted.
I'm back. I can hear you. Can you hear me?
So the last few minutes really we were lost. So could you maybe wind back for 1 or 2 minutes?
Yeah, absolutely. I'm so sorry. I don't know what's wrong with my connection today. So, like I was telling Tony, can you hear me? Okay, so like I was telling Tony, Tony talks about the importance of awareness of the product. And one thing we notice is that people don't trust insurance, and we don't want to launch insurance and start telling people this still works without having a lot of people use the product first before we can create awareness. So like you talked about building those community insurance, we need to get to that level organically before we can then explore more people. We've been able to reach over 40,000 people, either people getting cash for insurance, or people getting cash for trash, or people getting insurance, or a combination of both. So we want to be able to say, okay, we've reached 100,000 people across different communities before we can say, okay, we then can now go into other marketing channels like radio, which works, on social media channels to reach more people. But for now, we prefer to constantly grow organically in a slow pace.
Like, how many states do you work in Nigeria currently?
We work in about 5 states. We work in northern Nigeria, we work in Port Harcourt, we work in Imo State, we work in Abia State, and Abuja. So we also have interest in coming to the West, like Lagos. Lagos is very big, so we are taking our time before we can come to Lagos. But one interesting thing we want to do is to limit our physical presence, because we want to be light assets. So we don't want to always set up locations at different places. We prefer now to sell franchises to people, guide them, so they don't have to make the same mistakes that we've made over a period of time.
So just a bit of question again about how the insurance works.
Absolutely.
So let's say I do not buy any insurance and all of that. Can I have access to the telemedicine? Can I have access to a doctor?
If you didn't buy the insurance.
Yes, but I know that there is a telemedicine service. So can I have access to that?
So you need to buy insurance policy that gives you access to telemedicine, because
so the basic insurance, what does it cover? Okay, can you hear me still? Oh man, I can't hear you.
gives you access to like, can you hear me now?
Yes, no, so I can hear you.
Can you hear me now? Okay, so the basic insurance gives you access to outpatient care, which is practically the major medical condition of a quarter of the Nigerian population, which is malaria. It gives you access to get to almost over 2,000 pharmacies in Nigeria. You can get treatment for malaria. You can also treat cough. You can get drugs for pains and headaches and all of these things without having to pay for it. You can get access to minor medical problems that doesn't require you, going to hospital. So that's where telemedicine comes in, because you don't just have to walk in there and get self-medication. So the doctor will call you, use their medical experience to understand what is wrong with you. Then they can ask you to go to pharmacy where you can get a malaria test kit. There's a smaller malaria test kit that can test you with an instant result. So that way they can be able to give you the required drugs you need. So if you want more complex policies, then you can buy that one. But we provide that basic to allow more people to get into the pool. So that's where the telemedicine is covered, the telemedicine that you talked about. So when you buy that, it gives you access to, you cannot call the doctor, you have constipation, you have headache, you can't flu. And the doctor have access to different local languages as well, not just English.
Yeah, how do you pull these doctors together? I'm just interested in so many things. How do you get the pool of doctors together? How do you recruit the doctors? Is that, for instance, if you're setting it up the same thing in a different country, what would be the mode for getting the doctors, the hospitals, the pharmacies? How do you pull that together?
So we work with insurance companies, and sometimes this is a collaborative effort whereby some of the services that we cannot provide, we rely on the effort of the underwriter.
Yeah. And it's interesting thinking indeed, Tony, to see if people very often own, the first thing is if they can have access or to a doctor, just to have a line where they can call a doctor. So that might also be increasing adoption rate, at least that they have a line where they can ask doctors. And second step would then be buying insurances. We have 1 more minute, maybe Jacob, I saw that you have a question and maybe a powerful tool to scale this model through saving circles. Jacob, are you still on the line?
Yeah, yes. I'm sorry, I'm just off camera this morning. But yeah, no, I just always like to throw ideas into the chat of how to, what I love about grassroots finance action and what I've learned so much is like it's just such a great model to build more autonomy. And so I was just curious about if something like that could be used to further strengthen a model like this, like Nonso's. And yeah, just I love using AI tools like ChatGPT and Google Gemini to really test my curiosity about applying new concepts to new areas, and but in like a practical and realistic way. So Tony, you inspired me to maybe look into that just out of my curiosity, and we'll share if I find something of interest.
So we have a few more minutes. Nonso, a question about, have you tried or considered to scale this solution through saving groups or self-help groups? So I think Tony also have been working with self-help groups. Yeah.
So we somehow work with saving groups, but these are more like cash paying customers, because we have 2 payment channels, like people who save money and a small portion of their income, they want to set it aside for medical insurance. So we have a couple of saving groups who we work with, but these are like, they don't want to do it for recycling. They just want to save money, and a small portion of their money, we convince them to use it to pay for hospital cash in case they get ill, spend money in the hospital, we can pay them back their money while they're away from their small business. So that's where we work with saving groups and organizations. But as well, one of the things we do is that our technology helps people recycling to be able to save the value of their recycling in their wallet. They can keep it there for 3-4 months. So we help them to build credit history for themselves, people who never owned a bank account before. We work with one of the biggest banks in Nigeria, Wema Bank, and we also do a work cleanup day with them on the 28th of September. So we have through the collaborative effort with them, we open bank accounts for low-income people who never owned bank account before. And the first money that have to go into that account is money from their wallet, which we have created for them. So you see that you are bringing people into the financial system who never had a bank, who never had a credit history, who never had a means because they don't have education and they don't have jobs, but now they have a level job that gives them a stable income to be able to generate that level of income. So for us, it's 3 things we aim to do. It's about financial inclusion, it's about providing financial safety for people, and it's about making sure the environment is right.
Well, that's super impressive. Maybe let's continue the conversation as a group of partners that are passionate about this. Of course, it doesn't stop here, but for this moment, I think we have to wrap up. Thanks a lot, Nitin, Tony, for all the questions and also the joint thinking of how can we scale this. I think there are a lot of powerful ideas, and Nonso, it was a great pleasure to hear more of this solution, and probably we didn't say the last word. We were gonna continue this collaboration. Thanks for all the others also popping in questions, ideas. If you have liked this learning circle, please don't shy away from sharing this on social media and invite others to participate, other partners to communities to participate in the future. So for now, thanks a lot to everybody that has made this call happen. Special thanks to Nonso, of course. Good luck with all the amazing work you're doing. I mean, I'm always inspired when you put a few strong social entrepreneurs in a room, magic will happen for sure. So thanks a lot. Hope to see you all next time. And if you have ideas for more on this topic, shoot me a line and we can make that happen. Thanks to everybody. Bye-bye.
Thank you. Bye.
Thank you.
Thanks.